Hello, everyone. Welcome to our think tank for the month of August. We are going to discuss engaging patients and family caregivers in bedside rounding. Here are our PFE metrics for care delivery. The Ready, Set, Go model, where it talks about the admissions checklist, shift change and bedside reporting, and engaging family members, and the discharge planning checklist, having it in place. So for last time we discussed the admissions checklist. This time we discussed the bedside rounding and huddles, and let's jump into it. So in discussing this with the hospitals, a lot of what people had to say were ideas for engagement, things that they were able to do with their hospitals that made a difference. So we had Kate Dalton from Adventist Health mention that they were able to include physicians and pharmacists on their rounds as they were rounding with patients. They acquired iPads for family members to remain engaged if they were not able to be there for rounds. And they were able to, get feedback from family and questions answered from support persons. They said they had a few challenges, but they're still persisting. They've had challenges with connectivity, being able to have a good signal, and they have had some challenges with just making sure people know when to connect, and they've had to kind of, pivot on that. So those are some of the challenges, but they are still able to get that to work. So also Michelle Johnson from Amita Health was also mentioning how they were able to do virtual inclusion with patients and families when necessary. They realized that the next of kin might not be a family member, so they are updating their checklist to add in that support person could be different from the next of kin person that's listed in the records. Also, Kate Dalton from Adventist Health did also mention that the support person's phone number was on the whiteboard in the room. So as a workaround for the next of kin being different from the support person, they just had it in the room on the whiteboard, and that was a way for people to instantly know who to contact for those kinds of conversations. Kimberly Falcon also mentioned that they do a welcome round at their hospital. So they educate patients about the shift change, about rounding, about, housekeeping, things that they should know about the hospital and how things work. And then they also do encourage the support persons to participate in rounds in shift changes virtually if they need it, but in person if they're able to. So those are ways that hospitals were able to engage patients and family in the bedside rounding, as well as shift change reports. And I hope that you're able to join us for the next think tank, which will be on September 8th. We will discuss new and different ways to engage patients and family caregivers. And always, you can find additional information about the Gateways Patient and Family Partnership Program on CLIC. See you next time.